Hi nerds, welcome back. Today I wanted to talk to you about something that's incredibly important but seems to be swept under the rug within the dog grooming community, and that is groomer's lung. And before I get into this video, please do keep in mind that I am not a medical professional. If you feel like you have any symptoms that I'm about to mention in this video, please consult your GP. Don't just rely on some complete stranger telling you on the internet that, oh, you may have a condition. And I always recommend you doing your own research on top of what you're about to discover today. Okay, as you may understand from the name of the condition, groomer's lung affects our lungs and our airways. You may have noticed a completely sudden persistent cough or shortness of breath, or even both, that seems to have come from nowhere, and if left unchecked it can lead to something as serious as pneumonia. But when you think about it, our work environment is actually incredibly easy to blame with this. We are exposed to small hair, dirt, dandruff, dead skin and various different aerosols on a daily basis, and if we don't cover our airways, all those particles can easily travel into our lungs and cause issues. And there was actually a study conducted in 2017, I will link the study down in the description if you wanted to check it out, that explored the connection between the lung issues and pyrethrin based sprays. Now pyrethrin is an insecticide, so most likely in this study that has meant a flea spray. Okay, and I'm just about to cheat on the basics of the study, so I am reading out loud from my little book of studies. The study evaluated a 61-year-old man with recent history of cough and shortness of breath, and he said that the only thing he was exposed to on a daily basis was just the dog grooming environment and an insecticide. And some of their testing did actually reveal reduced diffusion capacity in the lungs, and basically what this means is just the rate of which oxygen and carbon dioxide travels through some layers within our lungs. Testing also confirmed the presence of several different white blood cells that are consistent with ongoing exposure. In addition, an open lung biopsy revealed the presence of poorly formed granulomas and bronchiolitis. Now, if you're not sure what these terms mean, a granuloma is a commonly benign cluster of inflammation within the lungs, and bronchiolitis is a lung infection. And the results of the biopsy do kind of explain why the researchers did find so many different white blood cells within the lungs, as our white blood cells are designed to fight infection within our bodies wherever it is necessary. Patient increased ventilation and wore a P100 mask while grooming over several months, and this did improve his condition greatly. This led the researchers to believe that exposure to pyrethrin sprays within the grooming environment can increase the risk of developing groomer's lung. Now, this study only had a very small sample. It only examined one person, and in my eyes, just using some flea spray every now and then isn't enough to damage our lungs to that extent. Obviously, it is fantastic that it has been studied and that there's medical journals out there to prove it, but I do really think that there's more to it than just a bit of spray. Personally, I use flea spray maybe a couple times a month, if that, and this definitely wouldn't be enough exposure to explain my own persistent cough and shortness of breath. In the past, I would only ever wear a mask if I was blasting out a big hairy double coated dog, and I was actually never taught about the importance of wearing a mask while I was doing my training at college. But if you just look at these clips that I have on the screen right now, you can see the amount of small particles flying around in the air, and we will breathe in these particles every day while we're working. And just to get another point of view to this, I asked the Facebook group English Groomers Group for other people's views on the matter, and this is what they had to say, and it is terrifying. I have worn masks for a long time, way before the virus. A little cough, nothing shows on my x-ray, but it's still there. I have been trying to tell the girls at the salon I work in to wear them. They have done since the virus, but not always. I would definitely recommend it. I have heard of groomer's lung. I wear glasses, so don't wear a mask as it steams up. I have had an annoying cough for several years, but chest x-ray didn't reveal anything. 30 years of grooming dogs. Always had chest infections, difficulty breathing, and on high dependency ward 10 years ago with pneumonia, all pre-masks. Masks every day since May due to COVID. Not one issue since. Breathing so much better that I'm now into running and doing 12 miles a week with no issues. Will never not work without one now. 29 years grooming, worn a mask for at least 15 years. Have asthma, which the doctor confirmed was down to grooming. Symptoms were a cough and feeling like I had phlegm in my throat constantly. It got worse when I worked in a college where lots of dogs were being dried, and also when I was in my salon with other people working there too. It's improved a bit working on my own and is controlled with inhalers. For the last 2 years, I've been grooming from a tiny room with one small window and an air conditioning unit. It was serviced 4 weeks ago. The technician said it was the worst he'd ever seen in 10 years. I now wear a mask at all times. First 2 years into grooming, years ago, I had a pesky cough for 8 months, courses of antibiotics, tonics, then finally a mask. Cough disappeared. Never groomed without one now, 10 years wearing a mask. Although, hubby sometimes says I sound like a tractor when asleep. Just look at dander and hair on seals, that's what could invade your lungs without a mask. I have been wearing masks for over a year after having a really bad chest infection that would not clear. I used to have terrible sneezing, nasal drip too, and I thought it was allergies. Now I don't have any of that and feel loads better. I used to get really bad nose infections and nosebleeds where the hair would go everywhere. I started to wear a mask and it's cleared up. I was never advised to wear a mask when I began training to groom. Just before COVID, I began to look into the damage it does to our lungs. Ever since we came back from lockdown, I've tried to at least wear a mask while drying dogs and make a point to keep my mask on for the whole groom if my dogs are especially mucky or have bad skin. To be honest, I haven't been grooming that long and haven't noticed a huge difference, but I understand that these things worsen over time and I don't really want to take that risk, especially now that so much attention has been turned towards respiratory health. And finally, I have asthma and noticed my lungs were more wheezy than normal when I started training. I am so grateful for this warning early on as it prompted me to buy and wear masks when I first started. If I've forgotten to wear one, I always suffer afterwards. It's important to realise that anything we breathe in is in our lungs for good. We learn that smoking is bad for our lungs. Why don't people take heed when breathing over foreign particles in? I truly believe we should all be wearing masks while grooming, COVID or not. Okay, so based on my own experiences and what you've just heard from countless other people, our job has such a huge impact on our airways and our lung health. It really worries me that we are not taught about masks. Obviously, if you have been, do let me know which educational body has taught you that, because I would love to know, because for me personally, City and Guilds did not include anything about this in their educational books. Now, the mask mentioned in the study is a P100 mask. This is a very heavy duty mask and probably would give you the best protection out of all the masks available on the market right now. I personally have been using a variation of mask ever since I started grooming. So when I first started, when I was only using masks when I was blasting out a double coated dog, I would just wear the disposable paper ones. And now since going back to work after our first lockdown, I've been wearing different cloth ones and also now a balaclava style, almost like a scarf style mask. It's just down to personal preference. I struggle with hair splinters all down my neck and that has really reduced it. And all my symptoms have cleared so well using any of these masks that I believe that just using a mask, doesn't matter how good it is going to improve your lung health so much. And with the current pandemic going on as well, there is such a huge array of different masks. You can even get fully personalized ones from bigger printing companies if you really want to tie your mask into your uniform. If you haven't been wearing a mask up until now, I urge you to buy a few and please wear them the entire day you are working for a few weeks and see how it improves your condition. And like I said at the start of the video, if you are concerned about your lung health, please go speak to a professional and they will be able to examine further. I am only raising awareness on the issue and I'm not going to be the answer to Groomer's Lung. And I really hope this video does start some kind of movement within the grooming community. We are so quick to respond if we have any issues with our muscles or our joints, and I want that kind of same response to happen if you notice that your lungs aren't doing well. But thank you so much for watching this video. I know it's going to be a long one, but I believe this is so important to talk about. We can't just keep ignoring the fact that we're coughing and wheezing and we're having nosebleeds and asthma and pneumonia. If we can improve our health on an individual basis, just imagine what we could do as a group, just speaking out about this and maybe even get it into education. So I would really love for all of you to share this with all of your groomer friends. Even send it to City and Guilds or OCN or whoever you may have trained with and let them have a look at this. And do leave me a comment down below if you do feel like your job is affecting your lungs and what you've done to prevent it, or if you've seen your doctor and they've not really taken you seriously or they've not been able to pinpoint the cause of it. But thank you so much guys. Do leave the video a little thumbs up and maybe consider subscribing to the channel so you don't miss my next upload. Bye guys.